Take off your socks right now. Look at your ankles. Look at the skin around them. Do you see an indentation where the elastic was? A groove that is still there 5, 10, 30 minutes after you took them off? Most people see that and think, I was on my feet too long. I ate something salty. It is just age. That groove left by your sock is one of the most informative physical findings in all of medicine. It is not about salt. It is your body telling you that one of 4 organ systems is under serious stress. The problem is not the swelling. The swelling is the alarm. The problem is what is triggering the alarm. Fluid does not accumulate in your legs randomly. Your heart, your veins, your kidneys, your liver, 4 completely different causes, 4 completely different treatments. And almost nobody explains which one is happening. I'm Dr. Arthur Sterling. Subscribe right now and hit like. What comes next, your doctor will not cover in a standard appointment. To understand why legs swell, you need to understand the physics of fluid in your body. Your blood vessels are not solid pipes. They are permeable membranes that allow fluid to pass in and out constantly. What keeps fluid inside the vessels, rather than leaking into surrounding tissue, is a balance between 2 opposing pressures. The first is hydrostatic pressure, the physical force of blood being pushed through vessels by your heart, which pushes fluid outward into the tissues. The second is oncotic pressure, the pulling force created by proteins in your blood, primarily albumin produced by the liver, which pulls fluid back into the vessels. In a healthy system, these 2 forces are balanced. When either breaks, hydrostatic pressure rises too high or oncotic pressure falls too low, fluid begins to pool in the tissues and gravity sends it to the legs. When either side of that equation breaks, fluid collects in the ankles, the feet, the lower legs. This pooling is called peripheral edema. Peripheral edema is never a diagnosis. It is always a symptom. Something upstream has failed, and identifying what has failed is the entire point of the investigation. After 50, 4 factors make edema progressively more likely, even in otherwise healthy people. Venous valve competence declines. Calf muscle mass decreases. Albumin production by the liver falls. And cardiac output drops by roughly 1% per year. All 4 systems weaken simultaneously. The margin for error shrinks. There are 4 primary causes of evening leg swelling in adults over 50. Understanding which one applies to you is the difference between treating the symptom and addressing the cause. The first is the heart. When the heart cannot pump blood forward with sufficient force, pressure backs up into the venous system, the network of vessels returning blood to the heart. That backed up pressure raises hydrostatic pressure in the leg veins and fluid is pushed out into the surrounding tissue. This is called cardiogenic edema. It is always bilateral, both legs equally. It worsens through the day and improves when you lie flat. If you need an extra pillow to breathe comfortably at night and your legs are swollen by evening, that combination is cardiac until proven otherwise. The second cause is chronic venous insufficiency, the most common cause of leg swelling in adults over 50, affecting an estimated 40% of the population. Inside your leg veins are small one-way valves that open to allow blood to flow upward toward the heart and close to prevent it falling back down. When these valves weaken or fail, blood pools in the lower leg veins and forces fluid into the surrounding tissue. Swelling is worse after prolonged standing or sitting and better after elevation. It is often accompanied by visible varicose veins and a feeling of heaviness or aching in the legs by evening. The third cause is the kidneys. When kidneys are not filtering efficiently, two things happen simultaneously. They retain sodium, which retains water, and damaged kidneys allow protein to leak into the urine, dropping the oncotic pressure that keeps fluid inside your vessels. The result? Fluid leaks into tissues throughout the body. Kidney edema appears not just in the ankles, it appears around the eyes in the morning. Puffy eyes when you wake, combined with swollen ankles by evening, is a kidney signal. The fourth cause is the liver. The liver produces albumin, the primary protein maintaining oncotic pressure in your blood. When liver function declines, albumin production falls and fluid leaks out of vessels throughout the body. Liver edema has a specific pattern. The abdomen swells before or alongside the legs. Subtle yellowing of the whites of the eyes may appear. Spider-shaped blood vessels on the upper chest are another marker. If leg swelling is accompanied by any of these findings, liver function is the priority investigation. Let me tell you about a patient I will call Thomas, 64 years old, retired accountant. He came to see me in October. His wife had made the appointment because she noticed his shoes were not fitting properly anymore. Thomas told me he had been buying shoes half a size larger for the past 8 months. His ankles were fine in the morning, but by 5 or 6 in the evening, his socks left deep grooves in his skin and his shoes felt tight. He had cut back on salt 3 months earlier. Nothing changed. I asked him 4 questions. Did he get short of breath lying flat at night? He paused. Actually, yes. He had been sleeping with 3 pillows for 6 months, but had not connected it to anything. Did he feel more tired climbing stairs? Yes, significantly. Had anyone told him his blood pressure was elevated? Yes, controlled with 1 medication. And had he noticed any change in his abdomen? He said his belt had gone up 2 notches, but he thought he had gained weight. 4 questions, every answer pointed in the same direction. Shortness of breath lying flat, stair fatigue, elevated blood pressure, belt 2 notches larger. This was not a salt problem. I listened to his heart. There was a third heart sound, called an S3 gallop, that indicates the heart is under volume overload. I pressed my thumb above his ankle. The pit took 8 seconds to fill back in. I sent Thomas for an echocardiogram, an ultrasound of the heart that measures how well it pumps. His ejection fraction, the percentage of blood the heart pumps out with each beat, normally above 55%, was 38%. He had heart failure with reduced ejection fraction. Stage 2. 8 months of buying larger shoes while his heart was progressively failing. His cardiologist started him on 3 medications, standard of care for heart failure. Within 6 weeks, his ankles were normal by evening. Within 3 months, his ejection fraction had improved to 48%. He went back to his normal shoe size. Thomas's swollen ankles were not a nuisance. They were his heart asking for help for 8 months. He just needed someone to translate. Here is a 3-step assessment you can do right now. Step 1. The sock test. Take off your socks at the end of the day and look at both ankles. If the elastic left an indentation still visible after 5 minutes, that is edema. Note whether it is equal on both sides. Bilateral equal swelling points toward heart, kidney, or liver. One leg significantly more swollen than the other points toward a blood clot, which is a medical emergency. Step 2. The elevation test. Lie down and raise both legs above the level of your heart. Prop them on pillows or against the wall for 20 minutes. If swelling reduces significantly with elevation, the fluid moves with gravity, characteristic of venous insufficiency or mild cardiac edema. If swelling does not reduce, the fluid is systemic. That points towards kidney or liver. Step 3. The morning check. Look at your ankles first thing in the morning before getting out of bed. Look at your face, particularly around the eyes. Legs normal in the morning, swollen only by evening, gravitational causes. Legs already swollen when you wake, or face puffy around the eyes, that is a systemic pattern. Kidney and liver causes do not resolve overnight the way gravitational causes do. Evening leg swelling is one of the most common complaints I hear, and one of the most consistently undertreated. Not because treatments do not exist, because the cause is rarely properly identified. The standard response in most clinical settings is to prescribe a diuretic, a water pill, and send the patient home. Diuretics will reduce the swelling. They will not fix the leaking valve. They will not improve ejection fraction. They will not restore liver albumin. They treat the symptom while the cause continues to progress. This is not a criticism of individual physicians. It is the predictable result of a 7-minute appointment and a system that rewards intervention over investigation. For venous insufficiency, graduated compression stockings worn during waking hours reduce venous pressure and slow valve damage progression. Elevation for 20 minutes twice daily accelerates fluid return. Walking, specifically calf muscle activation, is the most effective non-pharmacological intervention for venous edema. The calf muscle pump is more powerful than any compression garment. For cardiac edema, the investigation matters more than the treatment. If you have bilateral leg swelling, shortness of breath lying flat, and exercise intolerance, request an echocardiogram specifically, not just an EKG. An echocardiogram shows ejection fraction, valve function, and pump strength. An EKG does not. For kidney edema, urine microalbumin and a basic metabolic panel. For liver edema, liver function panel, including albumin level. And across all 4 causes, sodium restriction is the single most universally applicable intervention. Every gram of excess sodium retains approximately 200 milliliters of water in the body. Reducing dietary sodium to under 2 grams per day, which means eliminating processed food, not just the salt shaker, reduces fluid retention regardless of the underlying cause. Evening leg swelling affects an estimated 30% of adults over 50. In most cases, it is investigated inadequately and treated symptomatically, and the underlying cause continues to deteriorate quietly for years. How old are you? Write it in the comments right now. I want to see who is watching, because the conversation about leg swelling at 54 is meaningfully different from the conversation at 72. And I want to make sure what I cover next speaks directly to where you are. Here is your action plan. Sock test tonight. Both ankles. Note the depth and duration. Elevation test. 20 minutes. Legs above heart. Note where the swelling reduces. Morning check. 3 consecutive days. Bilateral swelling with shortness of breath. Request an echocardiogram, not just an EKG. Reduce dietary sodium starting today. And if one leg is suddenly more swollen than the other, go to an emergency room today. A unilateral acute swelling is a blood clot until proven otherwise. Your legs have been carrying you your entire life. The fluid in them tonight is not an inconvenience. It is a message. I'm Dr. Arthur Sterling, and I have spent 15 years watching patients treat the message as a nuisance while the sender kept escalating. Subscribe, hit like, and send this to someone whose legs you want to keep walking. The healthcare system profits from treating the symptom. I profit from finding the cause.